Hello and welcome my bald and bearded friends. Today a video, and you already read the title probably. I guess it could be quite interesting however, so if you're not working in healthcare, perhaps you learn some things about it. But today I wanted to talk about shaving others in healthcare, or just generally shaving others and then sliced up in parts with its own difficulties, because you can probably imagine shaving just an elderly person, if yourself are quite young, can be quite difficult because of the layers of skin you have to pull and etc. But shaving others in mental health care who are probably afraid or aggressive is a whole nother ballpark. Or shaving others in severely or multiple handicapped persons, shaving them with the tremors, so shaking, or just general slapping your hand away, or just screaming in your face. It's totally different than shaving an elderly person or just shaving yourself or whatever. So I think it's pretty interesting to talk about it. I've worked in all three of these sections. I've shaved people in mental health care, in multiple handicapped health care, also elderly people so far, and of course myself. So I have quite a bit of experience. I would not say I have years and years of experience, and if you have a point I not pointed out in this video, please comment down below. But I thought it was a quite interesting subject, of which I couldn't find that much of information. This will be all like of the top of my mind kind of video, and let's talk about it. Starting off with my personal favorite, which is mental health care. In mental health care, it's quite necessary to know what the diagnosis is. Diagnosis. Damn, I forgot the English word for it. Never mind. Diagnosis is because if someone is schizophrenic, you should have all another approach to them with shaving them. Then if one is autistic. See, there are a couple of things you really need to think about in mental health care, and that is how does the patient handle stress. It can be quite stressful to be shaven. Also, what are triggers for them? It could be the knives, in the blades, which trigger them to aggression or anxiety. But it could also be, which I encountered, being afraid of the sound of the shaver. I once shaved I shaved them a lot, but I once shaved a really autistic young man, so autistic that he could speak but couldn't speak later on in his life because of his autism. He just was too shut off of the world. If you catch my drift, what I mean. But the sound of an electric shaver was too much impulse, too much input, too much unnecessarily stress for him. So he had to be shaven, wet shave. So it is really important in mental health care to know the diagnosis of your patient, but also preferences, anxieties, and where it all comes from. Because of course you want them to be as relaxed as possible, because especially if you shave his shave right here, you have to pull the skin a little bit, and you really have to touch them, and that can be, for most people in mental health care, can be a real difficult trigger while shaving them, because they can feel attacked. This is of course really dependent on the patient itself, but a few guidelines I found out you can play with, to have your patient relax as possible, is perhaps music. Really heavily autistic clients, patients, most often just want to be total silent, because the stress of pulling on the skin and shaving is already way too much to can handle even a little bit of music. So you really have to check out the patient with it. Another thing can be scent. Scent can be really triggering for some people. It can remind them of traumas, but also be too overbearing, too pungent, or too heavy, if you will, that they get stressed just by the mere scent of the shaving foam or however. So it can be quite wise, especially with autistic patients, to use everything in the same scent, and if you can find it, scentless or a real soft scent, so that's not too overbearing, not too triggering, not too much for them. But again, every patient, every person on earth is different, so you really have to know your patients or the person you shave. Mental health care. Most often there is a quite high probability of violence, of course. They can feel threatened because you're gonna shave them. I also worked on a geriatric, a closed setting with real diverse mentally handicapped persons, from schizophrenia to anger issues, real violent people also. So what is quite important in this branch, the mental health care, is also how fast you shave them. You don't want to trigger them if you can at all, but shaving fast, with care, of course, but you don't want to let's look a little, yeah, alright, and how was your day? No, it's up a day, up, alright, you're ready for today, come have some breakfast, something like that, fast, not too much input, just be kind, of course, but don't give them too much triggers, don't give them too much emotional input, so don't be negative or overly positive about something, just nice, fast, on your way to breakfast, something like that. So that's the contact point, if you will, the physical, but also the contact point between the two persons is as short as possible, so that you don't have too much agitation, too much emotions, too much inputs, too much of everything, I guess. So that is the tips on the top of my mind for mental health care. Then we're going on to somatic care, which is of course the care you give, the bodily care, if you will. People who are paraplegic, who are wounded, have broken bones, whatever, that kind of care is of course totally different, because these are most of the time mentally real well people who just can't raise their arm, or can't do it itself, so they need to be shaven. All right. What's really important is because of they are so aware of that they used to do it themselves but can't right now, that they will be agitated just because you do it different than they used to do, especially if you work with a little bit older people, geriatric somatic care. They have shaven their face or their head or whatever their whole life, or the biggest part of it, and they're used to doing it in a certain way. What can be quite helpful to, ease their frustration, ease their anxiety, ease their frustration, is to just ask how they used to shave themselves and how they want to be shaven. Perhaps someone wants to be shaven, wet shave with a DE razor, I don't know, a cartridge razor. Have they always shaven themselves with a shavette or just electric razor? Have they always used a trimmer instead of shaving, and are really used to the scruffiness of the trimmed area, and just are disappointed or a little bit frustrated because their skin feels different because they're shaven in another way? Or perhaps they're used to only doing one pass because they really get agitated and just frustrated because second and third pass take way too long and they want to go to breakfast. It can be really interesting and really important to ask them what they want, what they're used to, and how they want to be treated in this way. Just actually for both of you to have the best experience. On the other end, of course, in somatic care you can also encounter wounds or irritation of the skin, or some kind of illness which make the skin more brittle or more easily agitated, more easily infected. Of course, if there is already a wound which is treated, most of the time you will not shave at that spot. If it takes a really long time, you can of course consult a doctor. In that case, if there's a wound and you want to shave exactly that spot, always consult the doctor and don't go shaving just it's already open. Stop. And so that is pretty necessary. The last section I wanted to talk about is multiple handicapped or handicapped care, which is of course a little bit different. It's however in some ways a bit the same of mental health care, because most of the time in multiple handicapped healthcare you have people who have a mentally development of, well, it depends of course on the group you're working on, but the group I worked on for last 2 years have a developmental age of 6 months to 20 months, something like that. Well, autistic person I just talked about in the first section, well, will be around 3 years, 4 years, as in a developmental age bracket. In this case, again, just like in the mental health care, you have triggers, of course. They can be feel threatened, so you want them to have a nice ambience. In my experience, I have to say that music works really well. Scents, lavender oil, some stuff like that. You have the aroma fusers, something like that's called, which is as a scented steam which fills the room a little bit. Those kinds of things can really help them to calm down. Of course, if they're really agitated still, you can ask their parents how they have shaven them so far, or the how do you say it in English? Old dog or something like that in the group you work with. The person who've worked them there for 10 years. You can of course ask them. It will be highly dependent on the person itself. Of course, the real difficult part is because of movement, or they try to protect themselves. Using force, to put a hand into place and just so you can shave it, or even hold their head, can be necessary. But because we are nurses or healthcare workers, are just we can't just limit their emotions like that, because that will be unlawfully. So I don't know how it's called in your country, of course, but there are, in the Netherlands at least, there are laws in which states that the doctor can be licensed in a way the legitimate use of force to shave someone, or just to perform all those things, shaving, toothbrushing, all those kind of things. So it's quite necessary, of course, in all these branches to have it, to have a written form from the doctor that you are in a way licensed, or you are permitted to use necessarily force to perform your task as a nurse or healthcare worker or whatever. What you do with someone who is really punching and trying to scratch you or grab you is, at least where I've worked, is really stand behind him and put your hands over their chest, just like this, trying to control their right hand. And then, in a little bit of almost a headlock, I would say, try to shave them as fast as possible, and then try the other side, and then try to shave their mustache area and their throat. Control their head a little bit, so where the head goes, the body follows. So if you pull them back, they will fall back, and you can shave the throat area. But of course, this should be consulted with the doctor, with relatives, with, if you can, the patient itself. This is not something you can just freely implement, because you're forcing really someone into care, which is not standard procedure. So this was all the tips I thought of for shaving someone in healthcare, no matter what branch of healthcare. Just because I'm ending today, should be my last day at the group I work on while filming this day, and I thought perhaps there are parents with really autistic children, or multiple handicapped children, or just healthcare workers who are not that experienced yet with shaving others, and perhaps this video could help them. So thank you all for watching. I hope this was a bit interesting. I know this is not the kind of videos I usually make. I am fully aware that this is not for my regular audience, I guess, but being a nurse myself, I think it's really interesting. So have a nice day. Ciao. Thanks for watching. Have I said that? I'm just rambling on. Thanks for watching. Ciao.